Welcome back to Philippines Uncut. I'm your host, Buddy Cunanan. Tonight's topic is alternative remedies to cancer. And still with us are Dr. Bienvenido R. Castro, anesthesiologist and Dorn practitioner, and of course, my good friend Hans Palacios, natural health advocate. Welcome, guys, to our second segment. And in the first segment, we ended by talking about thinking outside the box or stepping outside the box. And I want to show you a book that Hans brought out. It's called Cancer, Step Outside the Box by a certain
Ty Bollinger.
Ty Bollinger. Now, Hans, what is this book about?
Ty Bollinger is not even a doctor. He's just a person who lost a lot of his family to cancer. And then he started to research. It's basically the same thing I'm doing. We try to look for answers. There are a lot of questions, and they're looking over 100, 200 years into a question that doesn't seem to have any answers. I mean, we're now cloning babies. We have GMO babies in the last 2 weeks. It came out in the news. We sent guys to the moon. We have everything, technology, and all of a sudden, you know, we still have this perennial problem of cancer.
Yes.
Doesn't seem, because we're not moving.
And it's crazy, because I don't know how many billions have been spent in the last 50 years. I mean,
Billion.
looking for
Trillions probably by now.
On R&D, on studies, on this and that, trying to find a solution to this, and somehow nothing's working. In fact, going back to the case of my late father, he tried everything, hormone therapy, chemo, radiation. He even did stem cell, because the latest kid on the block is stem cell treatment. They're saying it's a wonder treatment, whatever. It didn't work for him.
But the thing is, did you address the cause of the problem? Now, you were talking about billions being spent, but all through this time, there have been cures. There have been success stories, but they were not in the pharma side of it. They were in the natural side.
Where there's no money.
Where there's no money, where the solutions are cheap.
Wait. I can see Dr. Castro laughing. Is there truth there, doctor, huh? You're on the spot now. You being a doctor, and I'm sure some of your colleagues are watching.
Buddy,
I'm not guilty.
Buddy, I'll do you a favor.
Yes.
There is it's just been placed, very well researched, very well put together. It's in the internet. You can see it in YouTube. It's called Cancer. It's a what you call it? It's a
book or no? It's a video.
It's a film. It's a 1.5 hour film.
Oh, it's this cure, cut, poison, and burn.
Well, that's another one.
Okay.
Cancer cures, unknown cures.
Okay.
So it outlines there from the year 1920, 1930, 1940, all the people who had success stories in curing cancer and been shut down by the American Medical Association, by the FDA, simply because, one, they cannot have, you have to spend $70, $80 million initially just to get something approved with the FDA.
Yes.
Eventually, you're going to spend about $600-700 million. So these little companies, though, these small doctors cannot do it. But in this video, you have a full rundown of all those cases that have been happening.
Yes.
And then you're going to have to change the protocols right now. Recently, if you look at the Lancet Oncology Journal, November 2011, they have identified that one of the causes for increasing cancer was the mammogram.
Yes, where they squeeze the breasts.
They squeeze the breast. They cause traumatic pressure on the breast.
Oh.
Then they apply radiation.
Wow.
The radiation applied is 1,000 times a normal X-ray.
Wow.
That's been measured. It's there. And then when they make the mistake, they do it all over again. Another 1,000 times.
I want to ask Dr. Castro, why is it like this? I mean, obviously there's Western medicine is falling short of the target. Why do doctors still continue to pursue this line of thinking? As Hans said, it's a recipe for insanity. You know, you do things again and again, and with no change.
Okay, so if you're in the box, probably the blind is just leading the blind. So when I was there, I saw everything. You know, the cause is not being addressed to. I don't see any treatment really, you know, curing the patient. So probably I had my own search mode.
Yes.
Okay.
Yes. You know, Hans gave me a book by Trudeau, and I've been reading it a little bit. That the things they won't teach you. I mean, the cure that they won't tell you about. And this guy Trudeau said that the doctors are trained in two things only: cutting things out of people, basically surgery, and number two, prescribing medicine. And that's it. But he says that they completely miss out on that, looking at for the cause,
The natural
the
things.
natural way, and health and wellness and all that. They're not trained in that. Now, when we first when we paused for our first segment, you mentioned something. You were going to say something about poking
Yes.
organs.
Okay, so you have a tumor already, okay?
All right.
And what does the tumor have? It's our abnormal cells. And what causes the abnormality of the multiplication of the cells? Usually, in our books, they explain it's a virus, it's a bacteria, okay, that can cause it. And usually, sometimes, too much inflammation, okay, and degeneration turning into cancer, okay. So, in my approach is, I see the tumor as a toxin. So once you poke it or once you do surgery, the toxin will spread into other tissues and again affect these abnormal cells, you know. Be it the bone or another, the liver, you know, another organ or something, or the brain.
Kumbaga, you're spreading
Okay,
it out.
so what do? In my treatment, you don't touch anything. You just improve the circulation through the spine, okay? Then you try to detox the patient. Try to use antioxidants, you know, which can really control these radicals and toxins. If it's a heavy metal, you use a mineral that can remove the heavy metal.
Okay, let's talk about detox. What are the most common ways to detoxify?
Okay, well, basically, if you don't want to drink anything, you just sweat. Okay?
Okay.
You can sweat out the toxins if you want. And the skin is the
Exercise.
third kidney.
Exercise.
Okay? Exercise. Okay?
Largest organ.
So you're improving the circulation. But if you're talking about internal organs, like the intestines, the large intestines,
Yeah.
and the most common cause of cancer, especially in lungs and large intestine cancers, is constipation.
Because you can't get rid of
The
the
toxins,
poisons and the
you just
toxins
absorb
inside
and
you.
absorb the toxins, and it gets to the liver, and the liver gets affected also.
Wow, wow.
So what we would do, we just align the patient, and the large intestine will just function.
What can ordinary people do to detox? Like, immediately, like practical applications, practical remedies.
Well, in the
Detox.
traditional way, okay, if you go to the provinces, they drink the lemongrass, the tanglad, okay, that removes the cholesterol, the uric acid, and makes you move properly.
So lemongrass is very good, huh?
Very good. It's documented already that it can treat cancer, colorectal CA, and I've done that to patients.
Lemongrass tea.
Tea
It's drunk
after
with tea.
meals.
Okay.
After meals.
Okay.
Take it 3 times a day.
Okay.
Then complement it with minerals that can remove the heavy metal in the body.
Let's talk about virgin coconut oil.
Virgin coconut oil is very good. Okay, it's a medium chain fatty acids.
So it doesn't make you. It's not a bad oil.
Okay. Well,
Big, yeah.
my experience is when I take it, your bowel movements is really different the following day. So everybody experiences that.
Okay. Let's talk about the misalignment of the spine. How does this happen?
Okay. So basically, what causes the misalignment of the spine is unnatural movements of the individual. Okay. So
Define that.
okay, a natural movement. Okay, so a natural movement is when you cross your legs, because the hip joint here, this one, you're going to see the hip joint. When you try to cross your legs,
Yeah.
okay, what will happen is the hip joint will be misaligned or subluxated.
Okay.
So what will happen? One leg will be longer than the other.
Whoa. So like this, like doing this.
Yes,
This
just
is
by
very
crossing.
bad.
Okay,
Yeah.
when you do taekwondo, okay, a lot of taekwondo participants or athletes are misaligned also. Sometimes they become scoliotic. Even if they get the gold medal, they have scoliosis.
Even if they didn't start out like that, like it's
Yes.
something that they acquired. It
Because
happened
when you
with time.
repeatedly do that unnatural movement, crossing of the legs, what will happen? There will be a difference in legs. Then it will end up with an uneven pelvis, and the spine will tilt already.
So what should people keep in mind to have a straight spine, a good working spine?
Well, our lifestyle nowadays, we're sitting like this, and sometimes we just unconsciously cross our legs because,
Yes.
women do that all the time.
I mean,
So,
I do it all the time.
So- so comparing it to the Japanese, they always squat when they take a shower.
is that good? It's
Squatting
good?
is so good for the spine and for the hip joints. So when they stand up, so in Japan, they have less incidence of cancer. Prostate cancer is practically zero in
They live
in
very
Japan.
long lives in Japan.
Very
I mean,
long
the
lives.
Very long mortality. Yeah.
So if you have a lot of unnatural movements, that's one that's going to cause the misalignments or scoliosis of
What
the
about,
spine.
we're always taught to sit up straight. It's good for your posture. It's,
Well-
is there a truth to that? Like, you've always been taught that as a child when in school, sit up straight, keep your chest out, stomach in, that kind of thing.
Well,
Is that good?
That's a good advice. Posture is the number one advice for us after treating the patient.
So slouching is bad and,
Yes.
and all that. Okay. What about when one is lying down sleeping?
Okay.
Which we spend a lot of time. I mean, all of us, some of us spend 1/3 of our lives.
Well, lying
Bed.
down is a neutral position. Okay.
Okay.
It's like your spine has the individual center of gravity, but when you're standing up, that's where the problem is. Okay, because there's only one center of gravity, and all of the bones should balance in one center of gravity. So when you're lying down, there's no problem with that. But if you have pain when you're lying down, there is something wrong with the misalignment in the spine.
Is lower back pain a symptom that something is wrong?
Okay,
with
that's
one's
the
spine?
number one complaints of my patients, low back pain, and that refers to the pelvic area.
Which leads to which illnesses? Which leads to prostate,
Leg
urinary
problems, then sometimes patients complain of varicose veins. They cannot
Women,
treat
yeah.
women, a lot of women, even men have varicose veins.
Now, you're saying the varicose veins are caused by again, a misaligned spine.
Okay, so how can I explain it? Because when the nerve is impinged in the spine, what will happen to the veins? They cannot close. They cannot pump the blood into the heart again. Because there's a nerve impingement. But once you align it, suddenly the varicose veins disappear.
What should women not do? Because I know women hate, don't want to have varicose veins. What should women not do to get
Well,
to
Number
avoid it?
number one is crossing of the legs. It's really number one.
Yan talaga, okay.
Okay.
Crossing the legs. How simple, huh? But I never thought that there would be so many ramifications from crossing one's leg.
That's the only way I can diagnose my patient. If they cross their legs in front of me, that's what I'm going to point out right away.
Let's talk about what goes on in your clinic. What does a typical Dorn method session consist of?
Okay, well, number one thing is when I see my patients, you know what happens? There's a lot of stories behind the disease, and they're going to present you a lot of MRIs and X-rays that were not, to me, they were not properly evaluated through
Kasi yung problema ng Western medicine, ba, Hans? Pag sinabing, you go to the doctor, what's the first thing the doctor will do? Okay, you take this test, you take that test, you do this, you do that, and then you go and take all these things, MRI, you get an X-ray, do all this, and then it lands in your hands. What do you feel about it when you get all these tests? I mean, are they useful? I mean, are they? Do they help you in your practice?
Okay, now, if they have MRIs or X-rays, even if they're very old already, I try to look for them because I want to trace the source of the problem. I don't want to see the latest. I want to see the old X-rays because that's where you're going to see where the muscles and the bones are acting out. Then you're going to pinpoint where the problem started, which organ will be affected. Then what will happen is the patient will just look at you like that, and when you start healing them, try aligning the bones, then they're going to feel the treatment right away. They're going to feel the healing right away.
When you say right away, what do you mean by
right away? The pain will
Immediately,
disappear.
As in, when they step out of your office, they're like, whoa, I feel like a new person. Like,
You're going to feel good.
No, pain is gone.
Because you have aligned the bones, at the same time you remove the spasm of the muscles, which is the one causing all the problems.
How do you do all this? Like, how long does a typical Dorn method session last?
Okay, the first session is partly the Dorn. Okay, so what do I call my treatment? It's sequential spine and energy healing. Okay, so it's a sequence. So as an anesthesiologist, I try to see to it that there is a proper conduct of healing. Okay, you don't just treat a person right there and then. You go to an oncologist, then have it done right, chemotherapy or radiation. No, you have to do a sequential spine and energy. The spine first should be treated, then the muscles, then the energy of the person.
When you talk about treating the spine, what do you do? I mean,
So that's the Dorn method.
This is different from spinal manipulation.
Okay, that's the Dorn method.
Yeah.
That's the gentle treatment of the spine. So when you align the joints in the spine, okay, then you go into the muscles, which cause the twisting of the spine.
How are you different from a chiropractor?
Quite different.
Explain.
Well, the chiro repeats his procedure all the time. So
but
the
it's also
patient comes back.
Yeah, but it's also spine manipulation, right?
Yeah, but what happens is, like in America, every corner they have a chiropractor.
Yes.
But once you have a Dorn method practitioner there, there's only one practitioner, and patients will not be going back and forth to the practitioner. And that's the difference. Okay? There's no repetition of the treatment. Once you do the Dorn method, the patient is aligned, something will happen to the patient. The patient will just heal by himself. And another difference is the chiropractor, to me, is too risky. Okay?
Of course, I mean,
it can fracture the
quite
bone.
forceful. I've
Okay.
seen it happen.
Twisting
Yeah.
can fracture
They
the bone.
crack it. They make your back make sounds. That's
Okay,
what-
as an anesthesiologist, I want to do something effective and safe to my patient. Because I'm a diplomate in anesthesia. My level of healing should be higher than, anybody else. So it should be effective and safe. So when I saw the chiro treatment, it was causing some spiral fracture. Sorry to say,
Whoa.
Sorry to say, I have to
No,
report
please,
that.
please.
Okay?
Yes, yes.
That made me decide that the Dorn method is really the effective and safest way of treatment.
Now, Hans, I understand that your son is an athlete, and he has actually undergone the Dorn method.
Yeah.
Why did you choose to bring your child to undergo this treatment?
He started to complain about flexibility, and he's quite young. And then I started to consult with Bien, and he said, "Why don't you take him over?" And he looked at him, and he started to point the problem areas. And then I said that there were certain things he couldn't do. So and he explained to me why he couldn't do it.
Like what could he do?
My son's a ball player, a baseball player,
Okay.
and he was talking about having difficulty using his hips. And then he said, "Look, the right foot is longer than the left, and we have to adjust that because one of the sockets, I think,
Okay, the hip joint was out.
Wow.
So he in one session he was able to fix that, and then he gave him exercises that he should do every night before he sleeps and every morning when he gets up. Just yesterday he told me, "Can you ask the doctor why when I do these exercises I don't feel resistance anymore? It's not difficult, it's easy to do it already." And I asked Bian, it's because it's working for him. It's not, wala nang resistance. It's now flow, it's now balanced.
He can do now. He can do these things that he wasn't able to do before.
Well, now he will have to train to be able to do that because he has been limited in his movements before.
So hindi sanay, the body is not
Yes.
used to it yet.
And my son has a bit of difficulty because he throws with his left, and he bats with his right.
Is that normal for a baseball player? Doesn't
Well,
seem
there
like
are,
it.
but
Not usual.
Not usual, and
Yeah.
that's the difficulty there. So it
Yeah.
caused an imbalance. You see, in
Yeah,
the
that's strange.
distribution.
He bats with his right
But
and throws with his left.
yeah,
Wow.
That-
Ambidextrous almost.
yeah, almost. Yeah.
Okay. Now, Hans talked about exercise. Is this let's say post treatment? This is part of the Dorn.
Yes.
method. One must do these exercises.
Okay, the Dorn method really has developed self-care exercises. So you can do these exercises at home. Okay, when you want to align your you just use a towel. Okay, then you try to do repetitive exercises. And the most important part of the exercise is there's a counter pressure and a dynamic motion. That is quite different from the chiro. The chiro, the patient is static. Then the operator will suddenly jerk the patient.
and they
In the Dorn method, the patient can do the dynamic motion and the counter pressure himself to align the joints and the spine.
You're saying that you can actually align someone's spine one session. It's
One
possible.
session.
That's it.
Okay. But of course, we need a follow-up to really double check.
So maximum 2.
Okay, so when you get to see the patient again, the patient looks different already. He's going to tell you, "Wow, you did a good job on my back pain."
So this doesn't seem like such a good business, huh? Because no repeat business.
You get to get new patients and clients all the time.
Of course. Referrals. Like me, I'm your newest patient, doc. I'm going to see you very soon. Okay. Now, you mentioned something about energy, which is also very integral to the Dorn method. And
Okay.
a lot of people these days, they complain that, my energy level's down. I sleep, I eat right, but I exercise, but I always feel like, like I can't, like chronic fatigue, whatever. What do you have to say about this?
Okay, so when we're talking about energy, we'll be going into the traditional Chinese medicine already. Okay, which are the meridians? Okay, the
This
energy.
is not part of the Dorn method. No.
Well, I want to explain something. This other chart. Can we
Okay,
look at this?
bring it up. Yeah.
Now, This is basically my, my basis for healing. Okay. Now, if you're going to see the spine here, okay, they have different colors. Okay. Now, this one on the other side are the energy meridians, which the traditional Chinese medicine anatomy is. Okay, that's their anatomy. That's where they found the energy passing through. And when you talk about the spine, we can relate the organs affected here with the energy in the body. So if you're going to look at these blue colors here, referring to the kidney and the bladder, you're going to feel symptoms in these areas in the blue lines. Okay? So we're going to have pain there, the leg cramps, the low back pain, the spine problem, and eye problems too. Okay? So where the energy passes through is related always to the spine. So the Dorn method, okay, which was developed in Germany, and the traditional Chinese medicine are related. See? So to me, that's so significant as a doctor.
Yes, okay. Yes. And practicing here in Asia, the two practices do somehow merge. And meet in the middle with this energy and as you said, the body, the spine, it's all about energy. Now, Hans, before we go, would you like to say something to the audience about cancer, about our wellness advocacy?
Yeah, there are a lot of alternatives, and you have to be aware. By the way, the title of the program in YouTube is Cancer, the Forbidden Cures. I would advise people to look at it because it's very well researched, and when they watch it, then it will open up their minds. Now, as far as maintenance is concerned, get a lot of sun. Vitamin D is very important for us. Sleep in the dark. No lights, no nothing. It has to be pitch dark. Why? Because that's when our body naturally produces hormones, melatonin, the hormone melatonin. So if you sleep with the light on, your body will not be able to do that. That's one of the important things. You have to eat a lot of vegetables and fruits. Keep away from processed foods, a lot of them. Now, there's a big problem brewing because, as we mentioned weeks ago about GMOs, this will just exacerbate the problems in the future. It's going to get worse.
Yes, yes.
See? For women 50 and below, avoid mammograms, definitely. Probably it would be better to go to do sonograms or thermograms because when there's swelling, there's problems. And the thermogram can easily pinpoint that. Then you can address to check whether there is a problem. The mammograms, normally there's a big percentage of women who mistakenly they diagnose a DCIS, which is what you call the ductal carcinoma in situ, which is just a normal growth.
Yes.
And then the number one first cure for something like that, first option was always a mastectomy.
Wow.
So you can imagine a lot of mistaken mastectomies that happened in the past.
Yes.
And hopefully we're going to stop that already.
Yes, yes.
So avoid, mammograms, they've proven it in the Lancet already. 650,000 women in the study, and they proved that on one side, the women who didn't take mammograms, and the ones who took the mammograms, 30% higher risk with a mammogram.
Okay, okay. Excellent. Well said, Hans. Doc, maybe you can tell the audience where they can reach you, how they can contact you.
Well, my clinic right now is in Quezon City. It's in Rosas Avenue. Well, the building is PB Junicio, okay? That's where you find the ammunitions. But my clinic is downstairs, the first floor. If you're just going to ask the guard, they'll guide you inside. Okay.
And contact details, perhaps?
Well,
or email?
just my cell phone number. Okay, can I say it?
Sure.
Okay,
Yeah.
it's 0917, okay, 584-3056, okay?
Excellent.
Okay, 0917-584-3056.
Thank you very much, guys, for coming on the show. And I'm sure this is not the last that we'll be talking about alternative remedies and alternative medicine. Thank you very much for coming on the show. Thank you.
Thank you so much.
Anyway, you guys, I hope you learned a lot about the Dorn method and alternative cures for cancer. I hope you join us again next week here in the show where we talk about what matters to you because you matter the most. I'll see you next week.
So it outlines there from the year 1920, 1930, 1940, all the people who had success stories in curing cancer and been shut down by the American Medical Association, by the FDA, simply because, one, they cannot have, you have to spend 70, 80 million dollars initially just to get something approved with the FDA.
Yes, yes.
Eventually, you're going to spend about 600-700 million. So these little companies, though, these small doctors cannot do it. But in this video, you have a full rundown of all those cases that have been happening.
Yes.
And then you're going to have to change the protocols right now. Recently, if you look at the Lancet Oncology Journal, November 2011, they have identified that one of the causes for increasing cancer was the mammogram.
Yes, where they squeeze the breasts.
They squeeze the breast. Ty Bollinger is not even a doctor. He's just a person who lost a lot of his family to cancer. And then he started to research. It's basically the same thing I'm doing. We try to look for answers. There are a lot of questions, and they're looking over 100, 200 years into a question that doesn't seem to have any answers. I mean, we're now cloning babies. We have GMO babies in the last 2 weeks. It came out in the news. We sent guys to the moon. We have everything, technology, and all of a sudden, we still have this perennial problem of cancer.
Yes, yes.
Doesn't seem, because we're not moving.
And it's crazy, because I don't know how many billions have been spent in the last 50 years, diba? I mean,
Billion.
looking for
Trillions probably by now.
on R&D, on studies, on this and that, trying to find a solution to this, and somehow nothing's working. In fact, going back to the case of my late father, he tried everything: hormone therapy, chemo, radiation. He even did stem cell, because the latest kid on the block is
They cause traumatic
Yes.
pressure on the breast. Then they apply radiation.
Wow.
The radiation applied is 1,000 times a normal X-ray. That's been
Wow.
measured.
Holy
It's there.
mackerel.
And then when they make the mistake, they do it all over again. Another 1,000 times.
I want to ask Dr. Castro, why is it like this? I mean, obviously, there's Western medicine is falling short of the target. Why do doctors still continue to pursue this line of thinking? As Hans said, it's a recipe for insanity. You do things again and again, and with no change.
Okay, so if you're in the box, probably the blind is just leading the blind. So when I was there, I saw everything, the cause is not being addressed to. I don't see any treatment really, curing the patient. So probably I had my own search mode.
Yes.
Okay.
Yes. Hans gave me a book by Trudeau, and I've been reading it a little bit. That Welcome back to Philippines Uncut. I'm your host, Buddy Cunanan. Tonight's topic is alternative remedies to cancer. And still with us are Dr. Bienvenido R. Castro, anesthesiologist and Dorn practitioner, and of course, my good friend Hans Palacios, natural health advocate. Welcome, guys, to our second segment. And in the first segment, we ended by talking about thinking outside the box, or stepping outside the box. And I want to show you a book that Hans brought out. It's called Cancer, Step Outside the Box by a certain
Ty Bollinger.
Ty Bollinger. Now, Hans, what is this book about?
It's
Stem cell treatment. They're saying it's a wonder treatment, whatever. It didn't work for him.
But the thing
It
is,
did not work.
did you address the cause of the problem? Now, you were talking about billions being spent. But all through this time, there have been cures. There have been success stories. But they were not in the pharma side of it. They were in the natural side.
Where there's no money.
Where there's no money, where the solutions are cheap.
Wait. I can see Dr. Castro laughing. Is there truth there, doctor, huh? You're on the spot now. You being a doctor, and I'm sure some of your colleagues are watching.
Buddy,
I'm not guilty.
Buddy, I'll do you
Good
a
answer.
favor.
Yes.
There is it's just been placed, very well researched, very well put together. It's in the internet. You can see it in YouTube. It's called Cancer. It's a what you call it's
A book or no? It's a video.
It's a film. It's a one
Okay.
and a half hour film.
Oh, it's this cure, cut, poison, and burn.
Well, that's another
That's
one.
another one. Okay.
Cancer cures, unknown cures.